Why fainting in young sports participants must be taken seriously. It is probably likely that most viewers of this short video would consider fainting as simply a benign occurrence and certainly not a potential harbinger of doom. In 2016, 10-year-old James, a young football fanatic, had just scored a goal for his local team on a sunny Saturday morning, watched on by his proud mother. Moments later, he lay dead on the pitch. Today, his mother still struggles to understand how her always-on-the-go son, who was never ill, could possibly have died. In young sports participants, fainting during or after exercise can be a medical sign, an objective indication of an underlying potentially serious medical condition that should mandate prompt medical investigation. In this context, fainting is not pathognomonic, meaning specific to one underlying condition. A differential diagnosis is required where numerous alternatives are possible. Fainting is a sign in at least 9 serious heart conditions, any one of which could result in the sudden cardiac death of an athlete. And in fact, it was one of these conditions, hypertrophic cardiomyopathy, that was the cause of young James's death. Fainting generally occurs because of an interruption of blood supply in the brain. This can either happen in the brain stem, which plays an important role in the regulation of cardiac and respiratory function, or in either of the hemispheres of the brain. Now, while there are numerous types of fainting, or syncope as it is known medically, there are 3 broad categories. These are reflex, or vasovagal, orthostatic, and cardiogenic syncope. Vasovagal syncope is one of the most common types and may occur in frightening or uneasy situations, such as, for example, with some people, at the sight of blood. Orthostatic faints are also common and are most often associated with movement from a supine or seated position to a standing position, most especially if this occurs quickly. However, it is cardiogenic syncope that is more likely to produce serious morbidity or mortality and requires prompt or immediate medical investigation. Although more common in older people, an effort to rule out irregular heart rhythms, heart valve problems, circulatory inadequacy, or diseases of the heart muscle is mandatory in all individuals, including the young who are outwardly healthy. No fainting episode should ever be dismissed as just a faint. All athletes who experience fainting during or after exercise must be medically evaluated in a hospital casualty department, and this is most especially true if they make a full recovery and feel very well after the fainting episode, as this is a characteristic of the cause of fainting being cardiac in nature. Furthermore, a witness account of the fainting episode is deemed vital information which the examining doctor requires. Specifically, did the athlete become very pale or grey immediately before collapsing, or after collapsing and before regaining consciousness, as this latter situation is indicative of cardiogenic syncope. The gold standard of care for athletes brought to a hospital following a fainting episode is that they should have an electrocardiogram, an ECG, known as an EKG in the United States, which looks at heart rhythm, possible admission to a cardiac care unit if the athlete has a suspected arrhythmia. This is because heart rhythm disturbances may be transient and not always evident at the time of the examination. Full blood tests are required, as well as a blood sugar test to check for hypoglycemia or low blood sugar levels. And finally, a CT scan of the brain to check for ischemia, an episode of neurological dysfunction resulting from an interruption of blood supply. It is true that James had never been ill. However, his mother admitted that he had fainted a number of times in the weeks preceding his death. But like most people, she didn't think fainting was serious, and it usually isn't. But when it occurs during or after exercise, it mandates urgent professional medical investigation. So please remember, all athletes who experience fainting during or after exercise must be medically evaluated in a hospital casualty department urgently. A visit to a GP is not sufficient.